So Janae, on your health history here, I see that you have torticollis. I just have a few more questions for you. What's your occupation?
I'm currently a student at Torticollis.
And your primary complaint is the torticollis, nothing else?
Yes.
Alright. So do you have any respiratory problems, like a chronic cough, shortness of breath, bronchitis, asthma, emphysema, or a sinus infection?
No.
So any cardiovascular issues, like high blood pressure, low blood pressure, CCHF, heart attack, varicose veins, phlebitis, stroke, pacemaker, or poor circulation?
No.
Any infections like hepatitis, TB, HIV, or infectious skin conditions?
No.
Any skin issues like rashes, athlete's foot, or warts?
No.
Any other conditions like loss of sensation, diabetes, allergies, epilepsy, arthritis, cancer, fibromyalgia, urinary disorders, kidney disorders, digestive disorders, or liver or hernia disorders?
No.
Any head and neck problems like vision problems, vision loss, hearing problems, or hearing loss?
No.
Are you currently pregnant?
No.
Or going through menopause?
No.
Alright. And are you on any medications right now?
No.
Alright, I'm just going to get you to read the bottom there and get you to sign it, telling me that you understand what we just went through. So how do you normally sleep? Do you have any previous trauma to the area? Are you taking any medication? Do you have a jaw disorder? When is it better and when is it worse? What is your quality of pain? How long does it last for? Where on the body is the pain? What was the onset of the pain? Does it radiate anywhere? So torticollis is also called wry neck and is a painful muscle spasm in the neck that pulls the head to one side while also turning the chin to the opposite side. Massage is one of the effective treatments for acute torticollis.
Okay, Janae, so now we're going to be doing assessment of the cervical spine, which is your teeth joint. So we're going to be doing flexion. So I'm going to ask you to have your chin towards your chest. Any pain with that? No. Okay, then we're going to do extension. So forehead back towards your back. Any pain with that? No. Okay, so now we're going to be doing lateral flexion. So at the spasm side, just go as far as you can go. Any pain with that? Okay, and then the opposite side. Any pain with that one?
Not so much.
Okay, so now we're going to move to rotation. So you're going to be moving your chin towards your shoulder on that side. Any pain with that? No. And then the opposite side. Any pain with that one? Yeah. Now we're going to be doing the peripheral joint scan. So I'm going to ask you to do the shoulder first, and we're going to move all the way down the arm. So first we're going to do the shoulder. So we're going to do flexion. I'm going to ask you to move your shoulder all the way up as far as you can. Any pain with that? No. Okay, now we're going to bring it down slowly and we're going to go towards the back for extension. Any pain with that one? No. Beautiful. Now we're going to do, after flexion and extension, we're going to do horizontal abduction and horizontal abduction. So first you can go towards your chest and then away from your chest. Any pain with those? Okay, now we're going to move to just So now we're going to be doing abduction and abduction. So abduction, having your shoulder go towards your head, so your arm going up to the sky. Any pain with that one? Nope. And then we're going to put it slowly down. And then we're going to ask you to do adduction, so towards the body. Any pain with that one?
Nope.
Nope. Beautiful. Now we're going to be doing internal and external rotation. So we're going to start at the mid-range, and we're going to ask you to do internal and then external, the opposite direction. Any pain with those?
Nope.
Beautiful. Okay, so now we're going to be doing supination. So we're going to go, like, we're going to hold on to a soup, and then we're going to do pronation, so like you're going to drop the soup. Any pain with that one?
Nope.
Okay, man. Okay, so now we're going to be doing ulnar deviation and radial deviation. Any pain with all those?
Nope.
Beautiful. Now we're going to be moving to the fingers. So the fingers, we're going to do flexion, like you're going to do a fist, and then extension, let it all out. And then we're going to do abduction, so spread out the fingers, and then AB, add them all together. Any pain with all those?
No.
So for Team J, we're going to be doing elevation and depression, so open your mouth and then close it. Any pain with that one? No. And then we're going to be doing protraction and retraction, so moving your jaw out and moving your jaw in. Any pain with that?
No.
Okay, and then so for compression, I'm gonna ask you in the seated position, which you're already in, and then I'm gonna put my hands on top of your head, and I'm gonna compress down the axilla through the thoracic. Are you having any pain with that?
No.
And if she did have to be a positive for radicular pain into the posterior leg, which would possibly be a disc herniation, which is a good sign that you don't have. Okay, so now we're going to be doing the distraction special test. In a seated position again, I'm going to put my one hand on her chin, and I'm going to put one hand on her occiput behind her head, and I'm going to try and pull it up. Any pain with that one? No. Now, for a distraction test, if it is positive, it would be if the client is feeling relief. So now we're going to move on to Spurlings, which is performed if the client complains of a nerve root symptom. The examiner, me, will be performing a simple compression in the neutral position, which would be exactly how she is now with her torticollis. And I'm going to be compressing down, right? Compressing down. Any pain with that one?
No.
No? And then we're going to ask you to extend your head as far as you can. And then we're going to do that one. Any pain with that?
No.
Okay, so we're going to be doing ipsilateral flexion and ipsilateral rotation to the same side. So we're going to be doing this motion. And then I'm going to compress. Any pain with that one?
No.
Beautiful. So a positive sign for a Spurlings would be radiating pain into her arm and lateral neck with the compression. Okay, so for her ADLs that she's having a hard time with would be putting on a seatbelt. So I think you should, pretend you're doing the motion. Okay, we'll do it again. Okay, so ADLs that she's having a time with for our program would be called functional assessments. Would be putting on a seatbelt. So having a hard time with that one. So an outcome measure for that would be I would want to decrease hypertonicity in the SCM muscle so she can put on her seatbelt with ease and without pain. Also, another one she's having a hard time with is typing on her laptop as her neck is in a more extended position. And also sleeping on the side of the spasm at night she's having pain with. Okay, so now we're going to be moving on to palpations. We're going to be doing tension first. I'm going to start on the affected side. And we're feeling very spasmodic muscles. Then we're going to be moving to the unaffected side, and it's pretty normal. Tone is very spasmodic also on the affected side. Now we're going to be moving on to texture. On the unaffected side, feels pretty normal, but if you move on to the texture side on the affected side, it feels very taut bands because of the spasmodic. Okay, so now we're going to be moving on to tissue and structures of abnormality. So the neck in the extension, lateral flexion, and rotation to the unaffected side. There's also going to be the shoulder to the affected side will be elevated as it is. And there's a slight torticollis due to her shoulder elevation. Then we're going to be moving on to temperature. So temperature on the affected side is very hot, a little bit more on the warm side instead of hot, I would say. And then there's tenderness. So on the unaffected side, there's not much tenderness, more just normal tissue. And then we move on to the affected side, and it's very tender on the affected side.
And now we move on to the treatment phase, where we show a 10 to 15 minute treatment, including positioning, draping, and appropriate techniques to achieve your treatment goals.
Now we have our client in a supine position, draped on both sides, and we're going to move on to the techniques. First, we're going to be doing a superficial effleurage. And now we're going to be doing C-scooping technique to the C-spine. And now we're going to be moving on to muscle stripping techniques. We're specifically working on the SCM muscle, which attaches to the mastoid process all the way to the clavicle and the sternum. And we're going to be moving on to neuromuscular techniques, specifically compressions. And then we're going to be moving on to trigger point work in the SCM. Again, originates and inserts on the mastoid process, clavicle, and sternum. Once we have found a trigger point, we are going to wait and put pressure on the trigger point area to try and decrease it to a 3. And then we're going to flush out the area. Exactly like so. Sorry. And the last technique we're going to finish the treatment with is called stroking, just to relax the muscles before the client leaves our treatment area. The therapist will be performing a combination of heat to the affected area, gentle massage, traction, and passive stretches to relax the tissue of the neck. The main muscles associated with torticollis is the SCM. The attachments are, it originates on the sternum, and the clavicle and inserts on the mastoid process behind the ear. As the neck muscles relax during the treatment, the therapist will start stretching the client's neck and attempting to move it through its full range of motion. So the therapist will gently pull the client's neck to stretch the fibers of the painful muscles and hold it in that position for a few seconds, and then stretch the same muscles on the opposite side of the neck.